Hi, my name is Dr. Kim Eichhorst. I am a board-certified dermatologist with fellowship training in MOHS micrographic surgery. I've created this video to make you an informed patient on the before, during, and afters of MOHS surgery. After the completion of this video, if you have any further questions about MOHS surgery, please do not hesitate to ask. Skin cancer is the most common form of malignancy in humans, and it's not something that happens overnight. Cells in one's body overall start out as healthy, happy cells, and with time and exposure to the sun and the elements become slightly atypical. And with even more damage to the cells, they become very atypical, so much that they grow out of control and don't abide by any rules of the human body. This is what we define as cancer. Luckily, metastasis, which is spread of tumor to distant parts of the body, is extremely rare with both basal cell and squamous cell. As a matter of fact, it almost never happens with basal cell. Squamous cell, on the other hand, can be more aggressive, and in general, about 2,500 people each year die due to cutaneous metastasis of squamous cell. The best treatment option is going to depend not only on the location and size of the tumor, but also how it's been treated in the past and if it has a certain subtype or aggressive behavior. Skin cancer does need to be treated. If left untreated, it will only continue to spread both deeper and wider. Therefore, regardless if the area that has been biopsied looks like it's healing well, it still does need treatment. MOHS surgery was designed over 60 years ago by a gentleman named Dr. Frederick Mohs. He was actually a dermatologic surgeon himself. The goal then is the same goal as is used now, to remove skin cancers with indistinct borders, with very aggressive behavior, skin cancers that have been treated but unsuccessfully treated by other procedures, and lastly, skin cancers that involve areas that are cosmetically sensitive. These would include areas like the eye, the ear, the lip, the nose. Again, the goal of MOHS surgery is to completely remove a tumor while minimally disrupting healthy skin. This ultimately gives almost a 99% cure rate and also the best cosmetic result possible. How should I prepare for surgery? Do not consume excessive amounts of alcohol for 5 days prior to and 48 hours after surgery. 1 glass of wine a night is fine. Take all of your regular medications unless directed by your surgeon or your regular physician. If you take any medicine containing aspirin, ibuprofen, pain medications, anti-inflammatory medications, arthritis medications, or blood thinners, please discuss this with our office prior to your surgical date. You should expect to eat your usual breakfast and take your morning medications as you normally would. Of course, medicines to exclude from this list are blood thinners. A list of blood thinners includes aspirin, and yes, even baby aspirin, ibuprofens. These products would include Advil and products like Aleve. Blood thinning supplements. These would include fish oil, vitamin E, garlic, ginger, ginkgo biloba, and flaxseed. These medicines and supplements should be stopped 2 weeks prior to surgery. Please also make your MOHS surgeon aware if you are taking Coumadin, warfarin, Pradaxa, or Plavix. Although these medications are not traditionally stopped for cutaneous surgery, your surgeon should be made aware that you are taking them, as it may affect decisions he or she makes during your procedure. Please also inform your surgeon if you have a pacemaker, defibrillator, brain stimulator, artificial joint, artificial heart valve, or if you take antibiotics before dental procedures. You will want to wear comfortable, loose clothing that you can easily get in and out of. Avoid pullover clothing. If necessary, we may give you a hospital gown to wear during the surgery. You may also want to bring a sweater in case you are cool. Please reserve the whole day for your surgery. Surgery time can be anywhere from 3 to 8 hours. This includes the time that is necessary for our laboratory to process your tissue and cosmetically close the wound created as a result of tumor removal. On the day of surgery, we encourage you to bring a friend or relative with you who can safely return you home and keep you company between each stage of the procedure. A driver is especially important in instances where the tumor borders the eye region. Although the MOHS procedure does not physically alter your vision, the large, bulky bandage placed upon completion of the procedure can hinder driving vision on your ride home. How is the surgery performed? MOHS micrographic surgery is performed in a procedure room under sterile conditions with local anesthesia. First, the visible portion of the tumor is removed with a surgical blade cutting a very thin layer. Each layer removed is called a stage. That layer is then cut into small pieces and a map is drawn to identify the location of each piece. The edges of the pieces are marked with dyes to aid in the orientation on a map. Each piece is then frozen and these slices are cut in a horizontal fashion and then stained. Next, 100% of the tumor edges are examined under the microscope. Any locations where the tumor is found are marked on the map. Regions with remaining tumor tissue are then re-excised. This procedure is repeated until all the tumor has been removed. After each layer of tissue is obtained, oozing or bleeding vessels are cauterized or ligated with suture. You may sense warmth during cautery as well as a less than pleasant smell, but you should experience no pain. At the end of the procedure, a bulky dressing is applied to the wound. Patients who undergo this procedure do so in relative comfort in an outpatient setting. You'll be waiting for the results of your tissue in a comfortable waiting room designated specifically for patients undergoing the MOHS procedure. The MOHS waiting room is separate from the regular office waiting room used for our usual medical dermatology patients. Overall, the MOHS experience is comparable to having multiple small biopsies over an extended period of time. Between each sample of tissue is a waiting period during which the tissue is processed real-time and viewed under the microscope. These steps allow you to leave the office at the end of the day cancer-free and ready to focus only on wound healing. Will MOHS micrographic surgery cure me? On average, it takes 2 to 3 stages before a patient's cancer is completely removed by the MOHS technique. For basal cells, MOHS offers a 99% cure rate, whereas squamous cell carcinomas have a 95 to 97% certainty of cure. However, follow-up visits to detect the rare recurrence are very important. I recommend full body exams every 6 months to ensure adequate surveillance. After the cancer is removed surgically, there are many options for healing of the wound. Since it is not possible to know the exact size of each wound until the tumor is removed, we cannot determine in advance how the wound will be closed. In general, there are 4 options to consider for closure. I will review these options in no particular order. Number 1, secondary intention. This technique is used when the skin is allowed to heal without stitches. The wound will simply heal from the bottom up with the help of an ointment and a bandage. Option 2, side-to-side closure. Here stitches are placed to close the wound and then removed in about 1 to 2 weeks depending on the location of the procedure. Option number 3, flaps. Here, skin adjacent to the wound is redraped over the wound and closed with stitches. And finally, option number 4, grafts. This type of closure requires borrowing skin from another area on the body, for example, behind one's ear. This borrowed tissue is then stitched in place to patch the wound left from the removed skin cancer. If this closure is chosen, it's important to note that you will leave the office with 2 wounds at different sites. Depending on the extent of the wound, there are some times when I may recommend closure by a surgical subspecialist if I feel that it's in the patient's best interest. At the procedure's end, all patients will leave the office with a bulky pressure dressing that is way out of proportion to the actual size of the wound. It is very important to leave this pressure bandage in place and dry for at least 24 hours following the procedure. Hi Lorraine, it's good to see you today. I know we're getting ready for your MOHS surgery and I want to know if you had any questions for me.
I did actually. I was just wondering how I got a basal cell skin cancer.
Well, it's a great question and one so many patients ask. And it's actually a combination of both the sun as well as a little bit of genetics. You're a very fair-skinned individual with light hair and blue eyes, so unfortunately you're a little predisposed. So it's a combination again of that genetic predisposition as well as sun over your lifetime. And so many of my patients will come in saying, I've lived in a cave for the last 10 years. How could I get a skin cancer now? So unfortunately, it's not really what you've done most recently. It's more way back in the past. And quite honestly, it's usually in the youth that we see sun exposure kind of build up over time.
Right. So wearing sunscreen now is not helping me that much with my previous damage.
Unfortunately, what's done is done. However, I do want to encourage you strongly to continue to wear your sunscreen because, again, this is cumulative. So being a reformist now certainly will help you moving ahead to the future, preventing further skin cancers from developing.
How much scarring will there be from this procedure?
So scarring is a great question to ask because anytime we cut the skin, there's always scarring involved, and I think it's important to set that expectation. It's not only my goal, but my promise to you to give you the best scar possible, and literally what that means is, in essence, engineering the scar so that it's inconspicuous or placed in such a way so that it's less noticeable. It usually takes about 12 months to a year for any cut skin to truly heal. Now, that's not to say you're going to be walking around with a Band-Aid on your nose for that time. However, over the next several months right after the procedure, you'll notice a drastic change. And then maybe around the 6-month mark, you might still notice some pinkness. You'll notice that the scar is there. But after the subsequent time following, that will fade. And again, so about a year and a half, you'll really have difficulty localizing the scar.
Okay, terrific. Will I experience a lot of pain with the surgery?
So during the surgery, again, it's all done under local numbing. We keep you numb and comfortable throughout. It should be very much like the biopsy that you initially had done to identify the skin cancer. So you'll feel that little discomfort in the beginning of the procedure and then be comfortable throughout. When you go home, most of my patients do exceedingly well. In general, I never prescribe pain medicines that are prescription, and if anyone has any pain, because everyone does have a different tolerance to pain, a little extra strength Tylenol is really all they need.
What will be the care that I will need to do with the spot?
Correct. Yep. So I'll start from the beginning because on the day that we do the procedure, you will leave with a very bulky dressing. It's way out of proportion to the size of the wound, and I actually joke and call it the sympathy bandage. So this will only remain in place for 24 hours, and again, you want to keep it there because the whole purpose of the bandage is to apply pressure, which is important during that time period. The next morning, the day after the procedure, when you wake up, you'll remove this bandage at home and then simply clean it with a little sudsy soapy water. Or if you want, you can even dilute hydrogen peroxide. I usually recommend half water, half hydrogen peroxide, and just gently cleanse the area. You'll then pat it dry and put a liberal amount of Vaseline. I want to be very clear here and recommend that you get a new clean tube of Vaseline and some clean Q-tips. And this will allow you to take very good care of the wound. Again, liberal amounts on the wound and then covered with a Band-Aid until we take your sutures out.
And about how long will I be here?
In the office, in general, the procedure starts about 8 o'clock in the morning, and unfortunately there are no guarantees, but you can expect to be here from around 8 till noon or all the way through to about 2 o'clock is the window of people leaving. So you do want to reserve the day to spend with us. Yes, you don't want to have work scheduled for later on, because even if you do get out early, we really want you to concentrate on your healing. We'll give you some things to do at home, icing the wound, making sure your head stays elevated. So it's really best just to take it easy that day after the procedure.
Okay. Will I be able to return to work the next day or my exercise that I normally do?
Sure, so that's something you really want to ease back into. Again, it depends what you do for a living. What kind of activities are you involved in?
I'm actually a nurse and I do exercise aerobic activity.
Okay, great. So with nursing, you just want to, again, be cautious of your positioning, how much you're exerting yourself. But in general, most patients do return to work the day after the procedure because there's really minimal pain. You do want to think about face-to-face time. Sometimes that's difficult for individuals depending on their workplace, only because you will be wearing a Band-Aid over the area. But physically, there's really nothing that should hold you back.
Okay.
Now, exercise is a slightly different story. You do want to avoid anything that's aerobic, meaning that gets your heart rate up or your blood pressure up. And this is, I usually equate it just if you're sweating, you're doing too much.
Okay.
So think about that. And in general, my rule is whenever we've recommended that you have suture removal, a week after that, so a week after suture removal is where you can really start to return to your normal kind of exercise routine.
Okay.
I do want to be very clear why I'm making this recommendation. Clearly, I want you to get back in action as soon as possible, but You're having work done on your face, and we want the best cosmetic outcome for the procedure. And that's going to include a little bit of work from you. But what happens is if you overdo it too soon, even though I've stitched you together, there are still blood vessels that haven't quite, gelled back together, and you can have bleeding underneath the wound. And even worse, it sometimes can open. So it is very important to just heed my warning and slowly return to your activities. Sounds good.
What if I have bleeding when I go home?
Sometimes it does happen. There can be some bleeding, or potentially the wound can even ooze a little bit. All you need to do is simply take some clean gauze and apply pressure to the area. You want to apply pressure for at least 5 to 10 minutes without peeking. The without peeking part is the key. If you take the gauze off and you're still having bleeding, you repeat again for another 5 to 10 minutes.
Okay.
And if you're still having bleeding at that point, please feel free to call the office and we'll advise you further.
Okay, great. Can I call at any time and be able to reach a doctor in the office?
Yes, you should be able to reach someone at any time. Monday through Friday, 8 to 5 p.m., you should call the office. And if it's after that time, so after hours, please call my personal cell phone number that's in the instructions we've given you.
Well, that would be great. Thank you.
You're
Great.
welcome. I hope you found this video helpful and informative. If you have any further questions about Mohs surgery, please don't hesitate to ask us. It's my goal to not only take care of your skin cancer, but take care of you.